And we're live with Coronavirus Conversations kicking off week 3, and I'm very glad to have everyone here with us. We've got a big crowd here on Crowdcast, and we're fixing to go live on Facebook any minute now. I want to thank our guests, Mayor Matt Starr, or Mayor Matt, as he's going to be referred to from this point forward, of the city of Mount Vernon, and his Safety Services Director, Rick Dzick, Rick Dzick. Is it Dzick?
You got it, Dzick.
Okay, thanks. So Rick's here with us to help represent some of the things that a safety services director does, and we're here to talk a little bit about COVID-19 in the city of Mount Vernon and in Knox County. I'm joined by my colleague and Knox County reporter, Knox Pages reporter, Grant Pepper. He's here with us on screen. Grant's going to drive a lot of the question asking today. And I'm going to kind of be his Ed McMahon to his Johnny Carson on this one. I'll tell bad jokes and try to stay out of the way. I'm also joined by our colleague, Brittany Schock, who is in the comment string and will help manage and keep track of everything as we move along through this process. Make sure we're here to take your questions. So be sure to ask your questions in the comment string or use the question ask function so that we can get your questions answered here on Crowdcast. And then finally, we just want to make sure you understand we're here to these discussions, which we've been having for the last couple of weeks, about a lot of different topics, are really intended to take our mission to be helpful to our community and useful to our community during this time, and create some value for you as our readers and our attendees. So without further ado, I want to just kind of offer an opportunity for Mayor Matt and Rick and Grant to briefly introduce themselves, and then we'll kick off and get into the discussion. So Mayor Matt, just give us a brief introduction, and then we'll kind of move around the circle here.
Well, thanks for putting this on. I appreciate you guys reaching out and getting information that's sort of uncut and uninterrupted directly into the readers, the viewers, and so forth. I think that's a really rich opportunity for your viewers and your readers to get information. And so I'm a big fan of this platform. Both Rick and I are. This is we finished our first quarter as the administration for the city of Mount Vernon, and so we've seen a lot of really cool things happen. And certainly, there's this challenge of the COVID-19 pandemic that has hit us and sort of taken over the reins, if you will. But I'll tell you, everybody here remains positive. In spite of all this, I absolutely love this job. I cannot imagine doing anything else. And I know working alongside Rick with his experience and his knowledge, and the team that we have with the city and the partnerships that we have with the greater city, if you will, we're going to come out on top of this just fine.
Rick, can you tell the viewers and audience members a little bit about yourself and how you kind of came into this job?
Yeah. So in my distant past, I guess you could say, I spent 10 years as a firefighter paramedic, 2 of those with the city of Mount Vernon. I then left Fire and EMS and ran the county's 911 center for 5 years. A little bit during that time, we had those windstorms, I believe, in 2012. At that point, we were in between EMA directors, so this is a little bit familiar for me, not too familiar, but I was serving as an interim EMA director during those windstorms. So very different type of emergency, but I am happy to have had the experience. It does give me a little bit of understanding of what Mark Max, our EMA director, is probably going through. Although this is on a much larger scale, and especially Health Director Julie Miller, they're working daily, probably 12-hour days, trying to make sure information gets out and everything's going great. So that's just my point.
Grant, you've been reporting in Knox Pages for us we're closing in on 2 years now, are we?
Yeah, closing in on 2 years. I started here in May 31st of 2018. So about 2 years, and this is my my first pandemic as a journalist during H1N1. Thank you.
We see him everywhere. We see him everywhere around town. You turn around, there's Grant everywhere.
It's really hurt me it's hurt me not to be able to. My favorite part of the job is getting to talk with people face to face every day, and that's been difficult. But yeah, the last time we had a pandemic was, I guess this one's been compared to is H1N1, at least at the outset. And when H1N1 hit in 2010, I was in 8th grade. So this has been a growing experience for me, and I'm glad to be here.
So let's kick off. Grant, why don't you kick us off in terms of guiding that discussion and moving us through these questions so that we can try to inform our readers as best we can.
Yeah, so I'd kind of like to start. I think it'll be good for our readers to kind of understand, our viewers now. For Matt and Rick, how did this process start for you at the city? So when did you first start thinking about our community's response to this? When did you kind of learn about this, and how has this unfolded in general for you at the city office over the last month, 2 months?
Well, I can start, and then I'm going to let Rick sort of fill in the blanks there. But it was pretty much when the governor started coming out every day, letting us know what was going on, and then our health department, Julie Miller, our health department commissioner, Julie Miller, was making regular updates to us and what we need to be thinking about. It started to get real, and then when it got real for me is when we closed down the restaurants by the order of the governor and the Department of Health. And that's when it got, okay, we need to really pay attention to what is going on here. And so Rick jumped into the deep end and really just put together a plan for the city, worked with department heads, worked with me, what my overall vision is, and really what was important was that the steps that we took early on was to protect people, protect lives, and understand our roles in this crisis, if you will, in this pandemic. And so we understood that the shots are being called from the president to the governor to the health departments, and the city is not in that, and we get our information from the health department and what's coming down from the governor. So very important that in that plan that I'll ask Rick to talk a little bit about how that guided us and how it still guides us in our decision making. Rick?
Yeah, so I'm actually looking at my calendar right now because that's a good question you came up with. I got a notification on March 8th that there were quite a few virtual meetings, webinars about this pandemic or what would come to be called a pandemic. And so it looks like our first meetings internally with the city, and that was with the fire department, really because we consider them our lead agency. They're obviously on the front lines. They'll be on the front lines throughout this. So Wednesday, March 11th was really when we got started with our planning as a city. Eventually, we then had a meeting with all of our department heads on how they start preparing. And, I do try and keep things documented pretty well. But, by Friday, March 13th, we were meeting as department heads. That following week, actually, it was that Friday that we asked people to maybe call before coming city buildings to do any city business. Just to give you an idea of how quickly this moved, by Monday, we were closing city facilities for that next Tuesday. So that informal request pretty much turned into you can't access city facilities. You have to call and make appointments pretty quickly. It was basically that next day. So I think we're talking March 18th or so, that we started moving a lot of our workforce to remote work where possible or on call. So a lot of our service department members were told to remain at home. They're expected to be on call when we have need. There's obviously certain services that we have to continue to provide. I mean, our water plant operators stay at work just as normal. A lot of our maintenance workers have to come in and do regular maintenance. Our distribution system guys have to do that. So it moved pretty quick between March 8th and March 18th with implementing a lot of the new policies and changes as a city. And, we've had to grow and adapt to it.
Yeah. So, Mayor, I kind of want to build off something you mentioned there in your comments, which was that at our city level, we're receiving a lot of guidance from federal and state leaders as to how we're supposed to handle this. What do you kind of envision? You lead a city of 16,000. Your role, the local government's role at this level, being in a situation like this. So obviously, it's a unique situation. You want to provide guidance, make sure we're staying healthy, but you don't want to interfere on individual liberties. So just kind of walk me through how you toe that line. What's your perspective on that?
Well, I think it's very important, first of all, that everybody in the communication chain understands their role. And as a city leader, as an administration, we are getting the information, and viewers can get the same information directly from the governor every day and directly from Julie Miller from our health department. And so you can see those things firsthand. Now, there are certain things that do come up operations-wise that Rick handles on that end. But again, our role is first understanding what our role is. Secondly, it's offering support to our Emergency Management Association, our agency. It's offering support to the health department, to the governor, to the president, and making sure that those directives are clearly understood. Those directives, just the whole notion of the social distancing, what's good standard practices, what businesses are essential, who should be out and about. And so it's really reinforcing what they are telling us. And so communicating that, or almost over communicating that to a certain extent, is one of the fundamental roles that I see the local government leaders providing.
And, one of the ways that your office has been doing this has been through the Facebook Lives and the Facebook videos and podcasts and things that also live on the city's website. So that's one way you've been trying to get that communication out from the city office. But there's a lot of information out there, period, right now. We're kind of living in this swirl of information coming from all directions. We're all on the internet right now, every day, 24/7. How challenging is that to make sure that there's leadership in messaging at the local level, and do you think what you've done so far has been effective? Obviously, this is all our first run at this. So, what's your perspective on it?
Well, I'd like to think that we are being effective. We'll wait to see. But let me give you an example on how we are working together to try to take things from a local level, or take the information that's coming from the state and the federal level and make it happen on the federal level. You are absolutely right. There are scads of information and articles and links and hyperlinks coming to us all the time. I get probably 100 to 150 emails every day, and every one of them is subject line is COVID-19. And so how do you sift through all of that stuff? And that's one of the things, that's where I see one of my roles is trying to, as a member of that group that sifts through all of that information, puts it into digestible sound bites or video tracks or even press releases, if you will, to help people find out what they need to do. Now, the example I was going to give to you is I'm really laser focused right now on our economic recovery plan, looking at research articles from the 1918 Spanish flu pandemic, and then what does our economic recovery plan look like? First of all, we have to prevent lives from being lost. So we have to keep people safe. That's number one. If we don't have a workforce, we don't have work
recovery.
And so that's number one. But when this wave passes us, how are we going to be poised to be able to do that? And so I'm meeting regularly, at least over the phone, with Carol Grubauer, Knox County Chamber of Commerce Executive Director, with Jeff Gotke, our Area Development Foundation Director, with Anthony McNeil, Main Street, Mount Vernon. I'm also calling different members of the business community, from different industries. Yesterday, I spent all day pretty much just checking on the retailers. That's a whole. Ask me about that later. That's a whole other story that is really developing. And so, what I see my role is in developing what does that economic recovery plan look like. And so we've got to get the right people at the table to help craft that. So when we're ready to hit the start button, we're off and running. And I'm going to be asking for, if there's going to be some stimulus money, I'm going to be asking, because we've got in Mount Vernon, we've got about 4 or 5 shovel-ready projects ready to go. And if we can get some federal assistance and make that happen and not have to deplete our city coffers, that's what I'm after. So that's part of my mission. I'm contacting our state and federal legislators and letting them know, hey, Mount Vernon is ready to go, and infrastructure is going to be a big part of that recovery plan, among other things.
Yeah. So without giving in, Rick, we'll kind of get in a second here how your job has kind of changed with all of this, and especially with city projects. But Matt, just to go back to what you said there, I mean, without giving away the playbook, what sort of, a lot of us are wondering what you've been working on right now in terms of economic planning and things like that. You mentioned there's you've got shovel-ready projects that you're working on. How would you characterize, to the extent you can right now, what those projects might entail? Or you mentioned infrastructure is a part of this, but without giving away your playbook, and I know these are all fluid right now, what's this look like for you?
Well, I can let probably Rick can answer some of that more specifically, because we have some projects that are out to bid. But the number one thing that we have to have done by November 15th is that North Sandusky Street corridor. We have to have a water line put in there. It's been needed. It's been several decades since we've actually done anything on that end of town, and infrastructure is. The termites are still holding on, which is making sure that everything is the water's still going through. So but we can't continue to just put Band-Aid after Band-Aid after Band-Aid on that. It's time to redesign. The time is now. And ODOT is going to start their project December 15th. So we have to be done November 15th. That is a big one. There are some other projects that are on the wings that we have generally appropriated. Again, I'll let Rick talk a little bit more about that. And then there's also an immediate need of helping the business community weather through this tough time. If they're not working, then our withholdings are down, and 80% of our budget, our city's budget, comes from withholdings, business and individual withholdings. And so, and we're seeing a real effect of that already, comparing last year's year-to-date to this year's year-to-date. But infrastructure, and Rick, you can talk a little bit more about some of the projects that are going out to bid or have gone out to bid that I think will be a fundamental ingredient to re-stimulating the local economy here.
Yeah, so for the most part, it's less the fact that COVID-19 is out there that's preventing or delaying some of our projects, and more uncertainty around what the economy will look like on the other side. So a lot of projects we are still moving forward on. We're doing so because the city's share of that project is relatively low, or it is dependent upon us getting funding for a future project. Anything that's 100% city financed is kind of on hold right now. And the example I'll use, and I hate using this because I know Tom Hinkler, our street superintendent, hates hearing this. Happens every time we hit a recession. We've been approved to go out to bid for our annual paving, street paving. Honestly, we need to invest a lot more money in regular paving of our streets, but it always seems to be the first thing that gets delayed, and it's probably going to get delayed again here, simply because we don't know what the finances will be on the other side. It's also not just infrastructure projects. Coming in, the mayor and I, at his request, had a pretty aggressive plan for modernizing just our city government. Everything from website redesigns to an app citizens can use to request services or report potholes. And these are things we were kind of hitting the ground running on in January. that are likely going to be delayed. Just again, we don't know we're finding. But what's going to be important on the other side of this is also prioritizing those. So I'll use this example. One of the first purchases we had to make in the first couple of weeks of this pandemic was a dozen laptop computers. The city was just not equipped for doing remote work, even though a number of our workers, so our water billing office has 5 employees, 4 of them work from home every day. Mm-hmm. Even our administrative staff here in the mayor's office, one of them is working from home at all times. And we didn't have even the technology to do that. So, when we do kind of a debrief after this whole thing is done, I think we're going to have to ask ourselves what types of modernization do we need to do as a city just to be, prepared for the next.
Mayor, do you have to leave soon? I know you mentioned, or are you available for the full hour?
Oh, I'm good right now. I'm fine.
Okay. I want to kind of ask, a lot of people here are probably thinking about this strictly in Knox County and how we're responding to this. But, from a mayoral standpoint, are you kind of reaching out at all to other local governments? Like I'm looking at, places around us that are similarly sized, maybe have similar, are similarly structured. And what kind of things are you learning from them that you're trying to take and implement here right now?
Absolutely. I am reaching out. Every week we have an Ohio Mayors Association meeting on Wednesdays. And so I get a chance to talk with other mayors from other municipalities on what they're doing. Again, right now I'm laser focused on the economic recovery plans and what municipalities are doing, not necessarily within their own government, but what are those public-private partnerships that are happening to be able to continue to make the economy continue to go. And so, there are other issues that come up. Understanding the CARES Act, understanding the PPP insurance. I can't remember the acronym, but keeping your personnel on payroll payroll protection plan. Understanding that and being able to understand how can we sift through all of that mountainous information and make sense out of it, because to a small business owner that is thoroughly intimidating. And so that's one of the things that is one of the things. There you go, Dzick. It's one of the things that I think we can figure out that what do the small business owners and operators need to know to be able to get through this.
Yeah. I mean, when I look at especially Mount Vernon, like our central business district, I mean, the way it's rebuilt itself over the last 15 years, it's really structured largely, it seems to me, around small business. Mm-hmm. And I kind of wonder, I think a lot of people here are probably wondering the same question is, when you look at how our economic fabric down there, just in downtown, what kind of concerns you the most? And, we don't know a lot of things right now. So what kind of concerns you the most about how we might be able to come out of this with that, our business district down there? Are there things we can do as a community to help our local business owners down there? I think people are kind of wondering those kind of questions, especially just because of all the small businesses we have in Mount Vernon.
Well, yeah, I certainly think there are some things. Obviously, Mount Vernon isn't. It used to be retail oriented. It was the king of retail. You would walk down and people would go into department stores and do shopping and everything like that. We're not really a retail downtown anymore. We've transformed into an educational and an entertainment based downtown, which is great. And I think that we are wrapping our arms around that new role in our community. It's not to say that we'll never go back to retail again, but there are different waves of evolution of every downtown, and we have embraced that point of difference, create an environment where we're attracting educational and entertainment. Unfortunately, in a hit like this, entertainment and restaurants are hit because people don't gather for that. And so, but there are some restaurants that do offer some takeout. It's a consolation when you consider one of our major restaurants, or two of our major restaurants, 98.5% of their business is done on dine-in only, not takeout. And so that's what their bread and butter is, and that's how they survive. That's how they make their money. The other small businesses, or the franchises, if you will, that are designed for takeout are doing well. That's good. And I spoke with a lot of them yesterday, from the McDonald's to the Taco Bell to the Domino's, Durco's, are the locally owned businesses also. They are doing well. They're not seeing much of a reduction in their profit margins right now, because they're built for that. Where they are struggling is they need support, because a lot of people that are working there haven't had a day off. And that worries me about the frontline employee. And I also would include the bigger stores, the bigger suppliers, and the key supply chain, if you will, Kroger's, Lowe's, Aldi's. It hit me Saturday, Grant, Jay. It hit me Saturday. I walked in to get my supplies for the week at the different grocery stores, and the workers were just tired. You could tell they've just been beat up, and items are leaving the shelves as soon as they're stocked, and it's like they're on a treadmill, and they need some help. And so I reached out and I said, look, are you guys hiring? Yes, we are hiring. We need some help, even if it's for just a temporary measure. That's something that we can do if there are some people who really want to work, that can get out there. I know these companies are looking for help right now, just so they can have employees fresh and at their best, because they're just getting hammered right now. And we need to keep them in our thoughts and prayers just as much as we do our frontline, our first responders. But for the downtown area, I think we've got a good group of owners and a conscientious business community. And also we've got a good educational base there that we're going to be able to weather this storm. It's diverse. And so I think the more diverse that we can make it, the more you can handle these rough parts of the market fluctuation.
Well, go ahead, Jay.
Grant, can I jump in there real quick?
Yeah.
One of the questions that I had that relates to that, Mayor Matt, is what's the city's, we've recently got guidance from both the state and the federal government about mask wearing when out in public, and you're thinking about, going, supporting those individuals in takeout, that are working in takeout and they're working in the grocery stores. Does the city have any particular stance on mask wearing for city officials or for city employees right now that you would like to share with our audience here, and maybe perhaps give Mount Vernon residents some guidance on where the city is headed with that?
Well, I'll let Rick speak up as far as operations, but I want to tell you, as just as a consumer, when I'm out, I wear a mask now. When I go out to the stores, I put a mask on. That's what the governor has been recommending, and so I think that's a good thing to do, particularly when I go into the stores. If I go out for a walk, maybe I don't do that. I stay far away enough from people that's not an issue. But anytime I'm around packages or food or anything like that, it's not as much, as I understand, the protection of getting or contracting the virus, but spreading anything that I might have. So not that I feel fine. I don't believe I have the virus at all, but just to be on the safe side, I think it's a precaution that is a wise precaution. Mm-hmm. Rick, I don't know if you can talk a little bit about.
And it's a temporary one too.
Right.
This is not a forever thing. But Rick, I'm sorry, I may have interrupted you.
No, you're good. I just want to reassure everybody the mayor's temperature was good this morning. So we did implement a couple weeks ago, or maybe a week ago. So it's all kind of mushing together at this point. But We do temperature checks with city employees each morning. Anybody with a fever over 100.7 is sent home. We have not had that yet. In terms of mask wearing, though, we haven't implemented anything citywide as it relates to mask wearing for our employees yet. I think the stance on mask wearing has kind of evolved over the weekend. And it makes sense. I mean, if you cover your face and you sneeze or cough, it stays in the mask. You also won't breathe anything in if you're wearing a mask. So I think a lot of the reluctance around mask wearing early on was to not take masks away from our healthcare professionals. Now we know we can make homemade masks. We can, take a bandana, put it around our face, and that all works. So this week I'll be investigating how we want city employees to utilize masks. It hasn't been as big of an issue because we've pretty much limited our employees' work to what they can do on their own. So just this week we'll have some city park mowing going on. We do consider that essential. We don't need ticks to spread in the city, so short grass is important. But again, that can be completed with obviously one of our maintenance equipment operators on a mower. Street sweeping's the same way. So for the most part, the work we're asking our employees to do has been individual. But that's not to say that there aren't projects or emergencies, road fixes that need to come up, water fixes that may come up, that require our employees to be around each other. And so I'll be looking into it a little bit more this week about when we want employees to be wearing their masks, and B, what we can find to provide to them in order to make that.
So, Mayor, how do you think we've, Mount Vernon, Knox County, how do you think we've kind of individually responded to this so far? And what I mean by that is with things like social distancing and our own efforts to kind of flatten the curve here. I mean, what do you think you've seen? What are your impressions of how we've sort of handled this through the first month?
Well, according to the data from the state of Ohio, we got a C in that. It's one of the things that our health commissioner, Julia Miller, is really emphasizing right now, how important that physical distancing is to keeping that curve flattened so that our healthcare services are not overrun by an astronomical volume of cases. And so we can do better. I think, when you see hundreds of cars out at the different retailers at any given time, yes, we still need to be out to get our supplies. But I think between last week and this week, we've made a huge difference because now there are even more visual cues in these different retailers to maintain that social distance. And in terms of even the retailers themselves, limiting the number of people who go into the store at a time. So I think we're making improvements. I would love to see that C bump up. Of course, I'm achievement motivated, so I want the A. But
right.
As long as we can make improvements, I think we're doing fine. But it's getting more real and more real. But we got another month of this, and so we're gonna have to dig in and do this right. And like I said, I think we're going to be much stronger on the other side of this.
One of the things that I love about these conversations over the last couple of weeks is how much I learn when I'm on these conversations. I had no idea that we were being graded until just now.
If you go to the coronavirus.ohio.gov website, you can look into some of the forecasts, and you can look into see how each county is doing on their social distancing.
That's great.
So there's a lot of data there that is pretty interesting if you start digging down into it. So
in the absence of high school sports, we're all still competing with one another in one way or another.
We are, darn it.
We're going for a win-win here, though.
That's right. Exactly.
Matt and Rick, what are you doing to take care of yourselves right now? I mean, a lot of us are asking ourselves each day, gosh, how do I get through another day of this? And as people who are not only dealing with the reality we all are, but are also in charge of running a city, like what kind of things are you doing? Jay calls them life hacks that you've thought of, developed over the last couple of weeks to help yourselves every day, mentally, physically, emotionally, kind of get through this.
Rick, I'll let you go first on this one.
All right. So I always consider myself, I mean, I worked in EMS. My wife's in the medical field, so I always consider myself to be a pretty avid hand washer, conscious of those kinds of things. But I will say I've probably stepped up my game lately. So, I'm more conscious of, touching door handles, light switches, washing my hands, occasionally going into the bathroom to wash my hands just because it's been an hour or so. So I am stepping up a lot of my cleaning regimen. I'm much more conscious these days than ever before about just distance that I have amongst people. I mean, clearly government's an essential service. We still have work to do, still have to, occasionally meet in person with people. So being extra cautious about, maintaining that 6-foot distance. I'm also, I told the mayor the one day, he goes, "Hey, you can call from my office." I go, "No, I'm not going to use your phone. I'll probably, we'll just pass germs one another." So phone usage, I mean, pen usage. I mean, I'm trying to be conscious of not using other people's pens. Just that's another transfer. So, it's not being overly, freaked out about it. It's just a matter of, paying attention to the things you touch daily and trying to make sure you touch your stuff and everybody else touches it.
Mayor, what about you?
I think for me, I'm sort of in that at-risk population because I'm a heart patient, and so I have a pacemaker and defibrillator, and so I have to be very careful anyway, and so this just increases my efforts to make sure that I am staying healthy and staying safe and staying smart, and so I make sure to get plenty of rest. I'm married to a nurse who makes sure I get plenty of rest, and I'm also wherever possible. And this was part of the thing about assuming this job is delegating wherever I can. As in my previous career or my side career that is on hiatus as an independent film producer, I did a lot of creative work. I did a lot of things on my own. And so now it's delegating to these very skilled people that are working for the city and seeking advice from a lot of others outside of the city on different matters. And so it's expanding my group of people that I count on for advice. And the other thing that I do to make sure that I'm healthy from an emotional standpoint is every Monday morning, it's a practice that I instituted when I took office. Every Monday morning, I meet with the chaplains for an hour. I have two chaplains, at least one or sometimes two chaplains, and I'll share my concerns and I'll talk with them about what's been bothering me or how I need to be focused. And again, it's just getting in a right frame of mind so that I'm making the best decisions I can, or the decisions that have to be made for the community, and knowing that's on some sound logic, that I'm being led spiritually through this. And that's extremely important to me, to be able to bring that comfort and that confidence that we're doing what's best for the community. And that's having that spiritual guidance with our chaplains is extremely important for me in approaching this job.
Yeah, one of the things that has kind of stood out to me, and a lot of people have spoken about recently, is how we really need to focus on being kind to each other now more than ever, just because we're so stressed out and we're all very anxious for different reasons. When I think about that, I think about, here in Mount Vernon and Knox County, we might be uniquely positioned to be good at that because we're in a kind of a smaller community here. We know a lot of people here. Typically, you know who your neighbor is here, things like that. Are there things you've been thinking about, maybe specific strategies or ways that have been running through your mind that we can be kinder to each other, and things maybe you've seen other communities that we can start doing here?
Well, I think I would tell you a great piece of advice that I learned from my mentor in the healthcare industry. When you feel frustration, when you feel anger, when you feel uncertainty, step back and think. Approach this almost from a logical standpoint. I mean, it might sound trite or simple, but it works if you just give yourself a pause just for a moment, just to buy yourself a second before you react to certain goings on around you, and just really think, okay, why am I being angry right now? What is this going to solve? Why am I being upset with this worker who doesn't have all the milk shelves stocked? Why am I being upset because I can't find toilet paper anywhere? What, give yourself pause and think, step back and think before we respond to different situations. I think just inserting that critical pause when we feel that anger, that frustration, can do an awful lot for us. And that's the first step in just being kinder. So I think seeing some of these people who are out there working on the front lines, obviously our first responders are doing a really nice job of staying on top of everything. Our hospitals are doing a great job, but again, it's those people that are in the critical supply chain. They're just getting beat up right now, and I wouldn't necessarily say verbally by customers all the time, but they're working a lot, and we need to keep them in our thoughts and prayers, and thank them. I think nothing is more motivating to me when somebody just comes up to me and says, "Thank you." I can, Mark Twain said, I can live 2 months on a good compliment. Yeah. And I think
all day on that.
Yeah, exactly. And so I think when you're out and about, just saying thank you to people is a great way to just being kinder.
Grant, one of the things that I've touched on this a number of times during the last couple of weeks, we actually had an episode with a friend of mine in Philadelphia who's managed remote teams for a long time. And one of the things that Chris mentioned during this whole period of time, which kind of relates to this, is that when you're not with people, you learn a lot about how a person is doing by simply being in their presence, how they hold their shoulders, how quickly they're walking, what their face looks like, what their mannerisms are. And now we're at the very minimum, we're 6 feet away from people. And like in Grant and you and my case, and in the case of all of our team, we haven't seen each other physically for, 3 weeks now. I think we're going on 4. And what Chris suggested was that when we're in those environments as team leaders or team members, one of the things that can be really helpful is that you have to be, it's a little awkward, but you really have to do the thing that you do naturally, which is, "Hey, Grant, how you doing?" And that just is sort of a hello. But now I really need to ask you, Mayor Matt, how are you doing? And it's a different kind of a question, but Chris referred to it as a health check. And we've done that quite a bit recently, and I find myself doing that with our team. And I really enjoy it when they ask me, to get an opportunity to just kind of share briefly like how I'm doing. So I think this sort of empathy and really checking in on people in a meaningful way can go a long way toward that. Well,
Jay, if I can just pop in there too, and Grant, this gets back to your question as to how we can be kinder. This is the same mentor that I spoke of earlier that told me to step back and think. Also had, I think, one of the most important management principles I have ever learned in my career is taking care of the people who take care of the people. And so making sure that your frontline staff are cared for, that they have their needs met, that they're getting what they need, is extremely important. And that doesn't necessarily cost any money. As Jay, it's just like you said, just checking in. How are you doing? Giving the few minutes, just tell me what's going on in your mind. That speaks volume. When you look at somebody, and I can look in your eyes and I can see some nonverbals here that I might not be able to see if we were looking at each other from across the room or across from a table. And so technology lets us into a little bit more of some of that nonverbal as well. But taking care of the people who take care of the people, I think, is another thing that particularly people in leadership roles can exemplify in those measures of kindness.
I want to jump in real quick and encourage our audience, both here on Crowdcast and on Facebook, to make sure that if you've got questions for Mayor Matt or for Rick, make sure you drop those in the comments or drop them in the comment string on Facebook. My colleague Brittany Schock is monitoring both of those comment strings, and she'll be sure to make sure that Grant and I have your questions in front of us so we can get those in front of the mayor and the safety services director. I'll turn it back over to you, Grant, but I want to make sure that we let our listeners know that now's a great time for them to drop their questions in so we can get those questions answered for them.
Yeah, absolutely. And thanks, Jay, for that reminder. And
no problem.
With the same kind of question with you, Rick. So obviously you have a background on the front lines. You mentioned your background in fire and things like that, and EMA to a certain extent. And as someone who's been in that position before, but probably not in a crisis of this magnitude, but held that sort of position before. And in talking with people who are there now in our city, what do you think, average citizens can do to be kinder or to lend support to people in those positions who are under a lot of stress right now? Because I think a lot of people are thinking, I want to help those people. I don't know how. Do you have any sort of insight as to how we might be able to do that?
So the mayor's asked this same question. I think he's constantly asking this question: is what can people do to help out? And I think the answer I give to him a lot of times is, some degree, it's heeding the recommendations. If the grocery store is crowded, can I go a different time, a different day? At the very least, can I respect the distancing? I know it's hard for a lot of people who are go-getters to sit at home and weather this out. But to some degree, in my opinion at least, the greatest thing people can do is just do the distancing thing, stay at home, and hopefully in a few months, or sooner, we'll be on the other side of this and it'll all be said and done. In terms of what people could do to help out, I think that's also what Julie Miller, our health commissioner, Mark Maxwell, our EMA director, are working on is trying to get out the word on what people can do. New mask wearing, recommendation, I could see a large value. I know people have been making masks and donating them thus far. I think donating to the community could help out as well, because even just our earlier question, I'm probably going to have to put out a policy on mask wearing in the city. I'm going to need to find a place to get these, not for our first responders, just for our city workers. So I think part of the message I've been getting from Julie and Mark has been, people can just respect the distancing that we have in place. We can really get through this. And then really seek out information. Go to watch Julie's Facebook Live every day. Although I think we're getting in the way of that. Okay, but that's okay. It's always up there. Listen to anything that comes out, and within that public information, there should be ways identified people can help.
And if I can just build on that too, there are other things. I know that in my conversation with the chaplains this morning, they are in their own churches. They call life groups, so they have different people who reach out to, or they say, hey, look, I want to, if somebody has a hard time, if they can't get out and mow their lawn, we want to be able to help some people do some outside chores if they are unable to get outside. Excuse me. Also, checking in, just calling someone who, calling family members or calling friends who may feel isolated. That connection, it just is invaluable, and it gets people through. And just the whole notion of just talking with somebody else can make a world of difference. So reaching out and just calling somebody who you may suspect might just need to say hello. And as Jay said, how are you doing? And really just genuinely get them to talk. How we get through this, part of the emotionally getting through this is just talking about it. That's what we're designed to do.
How do you think? I know you guys have probably been thinking about this, like everyone has. Long term, and we don't know where the finish line is right now, obviously. But from a big picture, how do you think this is a really unique crisis we're going through, and this is probably the first and only time we'll go through it, hopefully, as a society, and as a city. How do you think this maybe shapes the way we navigate our daily lives in the years, months ahead? I mean, is that something you're kind of thinking about right now? And what are kind of your thoughts on that?
Yeah. Constantly, I'm thinking about it. And Grant and Jay, you guys might particularly know this. I've been sharing this with Rick, but I've been crafting a state of the city address that probably is going to go out on through a video message. It's not quite done yet, but it very clearly hit me in the face 2 weeks ago that Mount Vernon, well, the country is on what Joseph Campbell would call the hero's journey right now. If you're familiar with Joseph Campbell and his model of the hero's journey, we have been called to action, we have been called to adventure, and we are beyond the threshold now. So life as we knew it is beyond us. And so we haven't quite reached the abyss, but we're in the tests and challenges. We're finding out who our mentors and our helpers are, and we're finding out who we can and can't trust. And once we are at that low point, whenever we reach that, whatever that is, we're going to come out transformed. We're going to have new information. We're going to have that holy grail that Campbell would call, which in this case, I think is just more information. And I think we're going to be bringing all that information back to the original world, and it's going to be so much stronger. But we really are on a hero's journey. By the way, some of the greatest stories ever written are during these times of trouble. And so I think we are writing our own history right now. We're finding out how we're going to get through this. We're chronicling. We're in much better shape right now than we were in 1918.
Oh my gosh.
To chronicle from a whole different perspective on how we were able to get through this. Think about that. We are able to tell stories, and you guys are primed for that, for your business to be able to chronicle these stories and how we're able to transform and come back to our original world much stronger. Think about the next generation that has to go through a pandemic 100 years from now. They're going to be looking back on podcasts and webinars like this to see how we did that.
You can add whatever you want. I mean, is there Rick, do you have any kind of thoughts on, how you kind of viewed this and what this might mean for us moving forward?
So I've actually, and this is a very serious pandemic. I think there's been other coronaviruses in the past, maybe less contagious, but more deadly. And so this to me is the prime opportunity for us to develop the systems, the plans we need for the next time. And that may be like with the Spanish flu, maybe 100 years from now, but at the very least, I think we will know how to respond to pandemic even better in the future. And obviously you always build on that. So in the future, something else will happen. We'll build on that knowledge and respond better from there. I like to think immediate term, and the job I had right prior to this was as a government consultant, and it was a company that was very progressive in terms of remote work. And there's still a lot of skepticism out there about working remotely. Are people as productive and things like that? And I actually think in the near term, a lot of our businesses will find value in moving toward more remote work for some employees, and also in realizing maybe that there are some productivity increases. What we've actually found with a few of our departments here is that employees are getting a lot more done. There's a lot fewer distractions. So, some mixture of, in-person and remote work for a lot of our businesses that are skeptical of it in the past, I think may change right on the other side of it.
Well, I mean, that's really all I have in terms of questions.
I've got a couple, if you don't mind.
Yeah.
Okay, great. So what do you, I'm trying to think through this question because I want to make sure that it applies, but I want to keep going on where we were with remote work and how that changes things inside of government and what you guys are thinking for Mount Vernon. Because one of the things that that has jumped out at me about our team and our business, and Matt, you alluded to this, is the opportunity that arises out of this in terms of the opportunity to tell stories in a way that helps us navigate the next time that this happens. because as I did a bunch of reading about 1918, and I couldn't help but come to the conclusion that part of the reason why why we may be seeing less, fewer deaths and fewer infections, is because of the fact that information flows much more quickly and with much less delay than it did in 1918. I mean, for Pete's sake, we didn't have a polio vaccine in 1918.
Right.
You have a background in communications and helping people with messaging. How important do you think it is for leaders like yourself, no matter what type of a town or a village or city that they might lead, to be out front and communicating frequently and authentically with the citizens that they're leading, Matt?
Well, authentically is, I think, the more powerful of the two. Mm-hmm. I think it's important that I'm out periodically, but I don't want to take away any of the limelight or any of the information that's coming from the governor or our health commissioner.
Right.
I want to make sure that I'm reinforcing what they're doing. I'm not trying to vie for airtime, if you will. I'm mm-hmm. trying to just get information, authentic information, needed information out there. So I think it's extremely important that that messaging is based on science, it's based on logic, and it's based on what people need to know, not what you want to tell them. What do they need to know? Those are two very different questions, and that's part of my marketing background. Is when people would want to do a commercial, I would ask them two questions right off the bat. Who is your audience and what do they need to know? Not what you want to tell them.
Right.
Because it's a very different question. And so I think, again, authentically providing people information of what they need to know from my role as a mayor of Mount Vernon is where we need to be. If we're asked to step up and provide what our lessons learned are on a grander scale in a different platform, we'll be happy to do that. But until our roles change, that's where I see the Rick's and my role in getting information out to the public. And right now it's pretty much a weekly basis. We're just recapping everything that we know and what those directives mean at the local level for us. So I don't know if that helps answer your question.
Absolutely. So we're getting towards the end of our time. Go ahead, Grant.
Well, I just have one more question. So sorry. So for I mean, the mayor especially, I mean, you mentioned how we're kind of at a point now where you've kind of established that, in your perspective, we're going through our hero's journey as a community, country, whatever, world. So it's going to get darker, and we're going to need each hero, when they go through that journey, they do heroic things that allow them to come out better, like you said, on the other side. What are things that you would deem heroic that our people in our city, our county could be doing right now that will help us come out better on the other side? Like, from your eyes, you apply this right now.
You got me all fired up now, Grant. Well, we have companies right now that are retooling, manufacturing, and you covered one of the stories. Shamrock Plastics, they're doing outstanding work in responding to be able to provide PPE equipment to our local hospital, which is then gone regional. We have three other companies that are working together: Eagle Engineering, Coin Graphics, and then also Replex Plastics, that are manufacturing face shields and supplying them to our local hospital. That's a heroic act. We have Domino's Pizza, who is partnering with the Red Cross and donating one pizza for every pint of blood. So we are full on our stocks right now, but we know we're going to be needing some more later. But those are heroic opportunities. We have people donating. We have restaurants who are hit really hard right now, taking monies out of their profits and delivering meals to our first responders, to the hospital, to the health department. Those are heroic stuff. What I'm hoping happens, big picture, and I'm talking personally now, but I think this is a wake-up call to the United States of America that we may have been so dependent on foreign trade for so long for cheap prices that this lights a fire under our entrepreneurial spirit. It says, hey, we can do that right here. We can make that right here in Mount Vernon for as inexpensively as we're paying all of the tariffs and everything else that we're buying from other countries. And so I think this is going to be an economic rebound like we've not seen. And I want Mount Vernon to be ready to house these companies. That's why I want to make sure that we get our infrastructure in place to be able to handle that inevitable rebound. But I hope this is a wake-up call to people who are saying, I cannot be the only person thinking this idea. I know that it's got to be widespread by this point. I think this is a wake-up call that we can really benefit from a made in the United States of America movement as a result of this. And I want us to be on the forefront of that.
Well, that's a great place to end. And I really want to thank Mayor Matt and Safety Service Director Dzick for appearing with us, taking an hour out of their day to help bring some understanding to COVID-19 in the context of Mount Vernon. I want to very much thank my colleague, Grant Pepper, who drove the bus on this interview. And there's nobody I know that's more qualified to do it because he knows Mount Vernon inside and out. And he just let me kind of keep my hand on the wheel a little bit and make sure that we knew what time it was and we didn't go for 3 hours today. I want to thank everybody that attended, especially my colleague, Brittany Schock, who was with us in the chat through this entire thing. And I want to encourage all the folks that are with us today to remember that this independent local journalism is being brought to you by people that live in your community. And we've had such support from Mount Vernon and Knox County for the work of Grant and his team at Knox Pages. We want to just thank you very much for that. If you're not yet a member and you'd like to be, there's a support our reporting button right here in Crowdcast, and you can go to sourcemembers.com/Knox to support Grant's work. And then tomorrow, just a quick plug for tomorrow's episode, we're going to talk about our 401ks and those envelopes that many of us just don't even want to open right now. But we're going to have two really smart guys who have a tremendous amount of experience in the finance business. And they're going to just talk to us not about individual advice, but just about general decision-making at a time, when things don't look as good as they looked a quarter ago. What's good decision-making to make and how to make those decisions in this time. Some of us are old enough to have gone through 2008 and 2009 and to open those envelopes and been really depressed at that time. And we want to make sure that folks have the information that they need to make good decisions in the context of their own lives. So we're going to talk about that tomorrow. On Wednesday, we're going to have the whole Source newsroom available to answer questions across all of our coverage areas about what it's like to cover a pandemic. We're going to sort of have an open line Wednesday, so to speak, where folks can ask any questions that they want of our reporters and get right next to us in terms of the news gathering and reporting process. On Thursday, we're going to talk about something I think a lot of us are thinking about, which is cooking and gardening right now. We're not ordering as much takeout as we used to, and we might be thinking about, I wonder if I can just grow my own lettuce this summer. And on Friday, we're going to end the series for now. We're going to close out this 3 weeks with a discussion on how to stay fit and healthy during a pandemic with an Olympic Taekwondo trainer, Chris Hirschberger of Black Belt Pro Fitness in Mansfield, along with potentially some folks from Ohio Health that are doing some really interesting things with remote fitness. So we hope you'll all join us then. And thank you very much for joining us on Coronavirus Conversations. Thanks, guys, for being here. And we're gonna say goodbye, and we'll see you tomorrow. Thank you, everyone. All right. Bye-bye.